Hello, I'm Dr. Joe Kent, and I'm your host of A Modern Pain Physician. I'm an interventional pain physician, board certified here in Bend, Oregon, and today I'm going to talk with you about epidural steroid injections. So an epidural steroid injection is essentially a steroid shot that is targeting pinched nerves either in the neck or the low back. Sometimes they can be done in the mid-back, it's just not quite as common. This steroid shot is used to treat pain going down the arms or pain down the legs. It is done in a fluoroscopy suite with X-ray guidance, so the physician can essentially place the needle right along where the pinched nerve is located. And the reason we do these are a couple-fold. First, they are used for diagnostic purposes, and so sometimes a pain physician or even your surgeon may recommend a steroid injection to target the nerves going down the arms or legs. And this is to help the surgeon determine if the pinched nerve is causing the symptoms. Why this may come into play is oftentimes people may have pinched nerves at several levels in their neck or their low back. And sometimes the pattern of pain doesn't classically follow the pattern that we think it should. And so if there are several areas of stenosis or pinching, then using the steroid injections can help the surgeon determine, do they need to operate on that level or do they not need to operate on that level? And so it can be used to both kind of rule in that as being part of the problem or rule that out. And so oftentimes surgeons will use this prior to surgery to help predict, will the surgery help for the symptoms that the patient is having? The epidural injections can also be what's called therapeutic, meaning it can be a treatment to help manage pain. And while it doesn't fix the problem, it can make the pain more manageable to allow people to live a more full life and to not be so negatively impacted by their pain. And so oftentimes they can be used as the destination treatment. People will ask, well, how long do these epidural injections last for? And what I tell folks is that essentially the steroid that goes in along those nerves essentially resets that nerve. And so how long it lasts is dependent on the degree of the stenosis or the degree of the nerve pinch. The people that have more severe stenosis, it's less likely to help for a longer period of time. But sometimes when you have stenosis, it can just take a certain movement or a certain activity and the pain can come right back. And so we don't really know how long the injections last for. They can last for several days, several months, weeks, years even. People will say the steroid shots help them. But we can't necessarily predict how long it's going to last. There are a couple different types of shots, and so if you talk with your physician or physician assistant, they may be talking about doing an interlaminar injection. And what that is classically, or not classically, an interlaminar injection is placing a needle right through what's called the spinous processes and right down in the middle of the spine. I typically use this type of injection for folks who have their stenosis is more in the center of their spine. This is a little bit less diagnostic, and so when we talked about earlier about part of the goals of these injections are trying to figure out where the pain's coming from. This is not a way that we would necessarily look at doing to figure out where the pain's coming from, but to help a certain problem. When we're starting to figure out where the pain's coming from, you'll hear about doing what's called a transforaminal injection. So if we look at the back and we kind of turn to the front of the spine, or the side, excuse me, you can see these yellow nerves that are exiting out of the spine. So a transforaminal injection is placing the steroid and the local anesthetic right along the nerve, and that helps us decide, is that nerve causing the problem or not? And so you may hear that there are a couple different types of steroid injections that you can have. The transforaminal being the most common, especially when we're looking at trying to diagnose the problem. And then the interlaminar injection is more so for things like central stenosis or lateral recess stenosis. Thanks for joining me today. I hope that was helpful in trying to figure out why you're getting these shots. And so take a look at my other videos and hopefully learn a thing or two about your back.